In 3, 2, 1.
Good morning, I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. And I am going to be live streaming cervical disc herniation surgery. We're going to be repairing 2 disc herniations on a patient who's from Israel. This patient traveled to the United States to have the Duke Spine Institute procedures. 2, 3, 4, 5, 5, 6. He has 2 herniated discs in his neck. C4-5, C5-6. Now, Lily, make sure you don't see patient name anywhere, right?
That is correct.
All right, good.
Sam?
This patient has symptomatic disc herniations, neck pain, and he did not want what was offered in Israel, which is fusions and artificial discs or shots, because none of those are good treatments. Instead, he wanted less invasive, more successful, faster recovery, with nothing left in his body, nothing foreign like metal or plastic, no cadaver bone, no biologics. He just wanted natural. And the Duke laser disc repair is exactly that. Let's go ahead and show our audience a video with the 30 different causes of neck pain. I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You can see there are 30 different causes of neck pain. This patient has many. He has 2 disc herniations, so that's 2, plus he has facet joint pain, Sean, plus he has, well, that's it. So 2 discs, and he had 2 facets. All right, we're going to go ahead and do our discogram. Before we do that, let's go ahead and count. C2, 3, 4, 5, 6. Everybody agree we're doing C5-6? So the first disc we're going to repair is C5-6. After we're done with C5-6, we're going to move up to C4-5. I'm going to do a discogram for 2 reasons. I want to see the tear in the back of the disc. There it is, big tear, big herniation. There's the tear, the black line, it's wavy, and there's the herniation, the black stuff there. So the dye appears black on x-ray, but it highlights the tear and the herniation. It helps me find it and treat it properly with the laser. Any questions, type them up, and Lily will be able to ask me the questions. By the way, we have Lily today. Henry is out on vacation. Lily's done a phenomenal job. She's trained under Henry. And yeah, thank you, Lily. If you have questions, type them up and I'll try to answer them for you. The incision is only 4 millimeters, 4 millimeter. As a matter of fact, it looks like a tiny little cut. You can't even see it after a few months. Most patients tell me, I don't see the incision, it's gone. And that's right. That's how minimally invasive this procedure is. You only lose a few drops of blood and the incision is invisible after a few months. You can't see it. The entire surgery is done with a 4 millimeter tube that we use an endoscope to go inside the disc shot. I'm going to advance the dilator. I'm going to use the X-ray to guide the advancement. Got to watch the guide wire, make sure it doesn't go in any further. Any questions? AP?
We have a question from Lanu on YouTube.
Sure, Lanu.
What is your view about discectomy?
Discectomy is an unnecessary surgery that takes out the entire disc when the surgeon should leave the disc there. It's unnecessary and not recommended, in my view. Discectomy, if all the surgeons knew how to do discectomy, fusion, laminectomy, and Duke laser disc repair, they would all do the Duke laser disc repair. There is no reason ever to do a discectomy anymore if you know how to do Duke laser disc repair. Discectomy, ectomy means to remove. Discectomy is to remove the disc. Why would you want to remove the disc? If you remove the disc, you're going to have to do a fusion or an artificial disc. Shot? Go ahead. Now I'm advancing the dilator to the back of the disc where the herniation is. We're going to go to the tear at the back of the disc. We're almost there. You can see the tip of the dilator is right at the tear. Now we're inside the tear. Now we're at the back of the tear. All right? So we are right where the herniation has come out of the tear. We're going to use the laser to clean it up and get rid of it. Any questions?
As of right now, no current questions.
Again, this is number 5-6, C5-6. Next will be C4-5. We're going to fix 5-6 first. Can you give me a little inline shot? I've got it. All right. Then in that case, you already showed them the 30 causes of neck pain, correct?
That's correct.
Shot. Then let's show them, shot, how disc injuries cause so much pain and how we fix it.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. Now you can see from our video that the disc is able to cause pain through a process called inflammation. Inflammation is your own body's reaction to an injury, such as a tear and a herniation. As a matter of fact, the tear is the first step, then there's a herniation. Once the herniation gets stuck inside the tear in the back of your disc, called the posterior annular tear, it causes horrible inflammation, which in turn causes pain, both in the neck as well as headaches. In many patients, headaches and symptoms like pain down the arms. I need a Raytech here. All right, we are getting underway with our first disc repair, number 5-6. There's some inflammatory tissue already. It's pink in color at the back of this disc. Any questions?
Yes, we have another question from Lanu off YouTube.
Hi, Lanu, and thank you, Lily.
How did this patient find you? Just curious. How
did the patient find me? YouTube. exactly how you found me, Lanu. By the way, Lanu, I think you're a nurse, right? And Lily is going to be a nurse soon. Lily is studying to be a nurse. She's been at Duke Spine Institute for almost 3 years, right, Lily?
Yes,
Huh?
that's correct.
Yeah. All right, guys, see the tear there? The tear right there in the back of the disc? And the herniation is this stuff right here stuck to the tear. That's why we have to use a laser. The laser is the only way you can safely remove the herniation out of the tear and get rid of the neck pain. Unfortunately, most spine surgeons are 50 years behind now in this technology, and they're going to continue to fall behind as we lead the world in curing back and neck pain. Yeah, thanks, Louise. All right, any other questions?
At this moment, no current questions.
So this patient is from Israel, as I told you. And the next patient is actually, where are we doing the next case? Here or the other room? Yeah. The next patient is a local. She had a fusion done on her back by me, 15 years ago, maybe almost 20 years ago. And she had L3-4, L4-5, L5S1 fusion, 20 years. Oh, look at the herniation. Do you guys see that? It came right out of the foramen. That was sitting on the nerve root, pinching the nerve root. That's the beauty of this procedure. It's called a reverse herniation. We got rid of it by basically removing scar tissue and letting it come out. So the next patient is going to have, she has what's called adjacent segment disease from the fusion. She has pain in the SI joints, and the piriformis muscles are both torn. So we're going to fix her piriformis on both sides. We're going to fix her SI joint on both sides. Okay? The patient after her is from Iceland. And he has thoracic pain, thoracic facet pain. We're going to go in and do the Duke plasma rhizotomy on his facets. He came all the way from Iceland. He actually had a medial branch block and radiofrequency ablation on his thoracic facets, and he had great relief. He said he got 100% relief, but it did not last. His pain came back after the RFA, which is true for everybody that has an RFA. Their pain always comes back. So that led me to pioneer a new treatment that was permanent, basically a permanent type of RFA, so that people don't have to keep coming back to the doctor and getting more treatment. Look, the problem today is that pain doctors are very happy to have you come back every year or every 6 months and have another pain management treatment. After all, that keep making money on you every time you come back, right? So they're not really motivated to cure your pain. They want you to stay in pain so that they can keep making money on you. And that's the system we're in today. Doctors not wanting to cure pain, but wanting to just treat it so they can keep making money off you and your insurance company. We're trying to change that. We want to cure your pain so you never have to come back and get anything else done again. That's what Duke Spine represents. We're the first, probably in the world, to offer cures for back and neck pain. Permanent treatment to get rid of it. All right, look at that tear. Look at that herniation. Oh, here it comes. Here it comes. All right, there it is. That's a herniation that literally I just released off of his spinal cord. It was pushing on the spinal cord. This is at C5-6. And when the laser's working perfect, there's another herniation right there. See that? The spinal cord down there? Okay, so this herniation was literally sitting on the spinal cord. This is the posterior ligament fibers. We're going to release them. Look how precise the laser is. It can literally release 0.05 millimeter at a time. That's the most precise tool in medicine. There is nothing that is more precise than the laser. All right, I don't see any more herniation. We got all of it out. and the spinal cord is right down there. We're going to go back and look at his right side foramen, which is where the herniation was going out the foramen on the right. We're going to clean that, but we're almost done with this C5-6 disc. His herniations were not humongous, but they were significant. So, by the way, for most people, they think that a big herniation causes more symptoms. There's more herniation right there. But the size of the herniation does not correlate with symptoms, okay? And the reason is that it's not compression by size, pressure by size, that causes, look at that herniation, guys. This is a beauty. Can you see this, Lily?
Yes, we can see it.
This is a pretty good size herniation. Look at that, it's 5 millimeters. A good size herniation. And we've already taken out several of them, but that was a pretty big one. All right, I was telling you that size doesn't matter when it comes to herniated discs. Everybody thinks size matters. It doesn't. What matters is how much inflammation is occurring as a result of the herniation. Lots of inflammation equals lots of symptoms, like headaches, neck pain, cervical brachial pain. Minimal inflammation means minimal symptoms. Any questions?
We have another question from Lanu off YouTube.
Sure.
Dear Lily, does Henry keep in touch with you just in case you have an emergency question or technical help?
That's you, Lily.
Oh,
She's asking you.
Henry is currently with no phones, no electronics, but he has trained me very extensively and thoroughly.
Thank you, Lily. Yeah, folks, I can talk about Henry. Henry is out with the stars, and he is just by himself enjoying nature and its quiet serenity. So,
Hope he's not in a hot swamp somewhere.
yeah, at least that's what he says. But I have sources that tell me he may actually be vacationing at Gator Alcatraz. Anybody ever stay at Gator Alcatraz?
No, but I got a U.S. passport, so I don't care.
Right. I'm just kidding. He's not at Gator Alcatraz, but I thought that was pretty funny. All right. We are pretty much done here. I don't see any more herniation. Everything's looking good. This will all heal by itself now that we remove the herniation out of here. This annulus right here will seal to the other side. We're done with this disc.
2 on, please. Thank you.
Okay, we're going to do the second disc in just a moment. But we did the Duke laser disc repair using a 4 millimeter. That's a very tiny, tiny incision. We're going to fix both discs through the same incision. We don't need to make a second one. Now, if this patient had stayed in Israel, he would have gotten the very best surgeons of Israel to do a spinal fusion. They would have given him what's called an ACDF, anterior cervical discectomy and fusion. That's where we take the disc out and put a spacer, an artificial disc, and a metal plate. I've done 1,000 of those surgeries, more than probably 99% of spine surgeons worldwide. That's a lot. I did a lot of spinal fusions in my time. I stopped doing them because patients don't want fusion. Smartly, they don't want fusion. They want something that's safer, more effective, and more natural, like the Duke laser disc repair. This surgery replaces fusion. If your doctor told you you need an ACDF fusion or an artificial disc, don't do it. This is a better surgery for you. You're going to recover in 1 hour. 1 hour from now, he's going to go home. You're also far less likely to get a complication. This surgery, we've had zero surgical complication. I mean zero. In 20 years. Okay? We've never had a complication. And it's very safe as long as the surgeon does it right. That's why you need a well-trained surgeon. You can't just go to anybody and, you know, hope that they'll do a good job. You got to go to someone who has a good record, like me at Duke Spine. Okay, 2, 3, 4, 5, 6. We're at 5, 6. Everyone agree? We're going to come out of 5, 6. We're going to go up to 4, 5. The next disc, C4-5. By the way, you see we've lost literally 1 drop of blood so far. We may lose a couple of drops here, but this is a bloodless surgery. There's no bleeding. Shot. I'm right on the edge. I can feel it. And this is an all-feel thing. You've got to have good hands to do this. I'm going to check my front back view to make sure, whoops, I slipped back in the disc. I'm going to check my front back view to make sure I don't come off the midline. I want to be in the middle of the spine. Hold on. Shot. Nope. Slipped again in. Hold on. Hold on. I moved up a little bit. Shot. We're in the middle right there. It's perfect in the middle. You guys see that?
Yes, we do.
Literally superimpose the tip of the dilator right over the spinous process. So I'm very happy with the AP view. Now I've got to line up the lateral view and get right over the disc. So I'm going to move up north, right here, shot. Got another 5 millimeters to go, shot. And we're right about where I want to be. Right there, shot. That's perfect. Now I want to get an AP, make sure I didn't slide left or right. You don't want to be off to the left or off to the right. You can hurt the patient very badly. So you have to be in the middle. I'm pretty much on the middle, but I slid a little bit to the right. Stay there. Now I'm coming back to the middle. Let's double check. Shot. Perfect. Right in the middle. Dead center. That's where you want to be. That's why you have to use the X-ray machine and you look at the bony anatomy to figure out where you are. Do not try this surgery at home. Somebody asked me, how long does it take to train a surgeon to do this kind of surgery? The answer I said was a year. That's an average. Maybe some surgeons need 2. Some surgeons may get it done in 9 months. But the problem is surgeons don't want to come here, take a year out of their life, not get paid any money to do surgery with me and learn how to do this kind of surgery. So we got a real problem, folks. You guys are going to be getting fusions for a long time because your surgeons don't want to learn how to do this surgery because it's a huge inconvenience. All right, there's the tear. Yep, since I'm the one doing them. And I can train 1 or 2 surgeons at a time, but yeah, it's going to be a while. What we really need is money, lots and lots of money being poured into our program so that we can train more surgeons quickly. And I could probably train 10 surgeons at a time if we had the right amount of money. But I don't have that kind of money. And it needs to come from somebody other than me, since I don't have it. Dr. Berndes, you want to make a donation? Dr. Berndes doesn't have it. I need about, I'd say $300 million US, easy. 300 million. I could train 10 surgeons at a time. If you know somebody out there with $300 million, have them call me. Have your people call my people. Berndes says that could maybe buy him lunch. He's not sure. Depends on where he goes. Chipotle, yes. Wow. It's amazing, isn't it?
We have another question.
Sure.
It is Lanu again on YouTube.
Oh, Lanu, thank you. Thank you for keeping us all on our toes.
She says, this patient's MRI doesn't look too bad, but a lot of herniation pieces in the surgery. How bad was the neck pain?
His neck pain was horrible. He's a welder in Israel. He's a heavy welder.
There's a lot of heavy work.
And he just could not do his job. He was in so much pain in his neck and his back. He literally could not do his job. So he knew something had to be done, and all they offered him in Israel was, by the way, the laser is from Israel. And all they offered was fusion. No laser surgery. Fusion and artificial disc. And he did not want that. After all, he's a welder. Why would you want to put metal in your neck? I mean, welders know, right? They work with metal every day. Why would you want metal in your neck? You wouldn't. So he's no dummy. He did his research. He went on YouTube. He found Duke Spine and our laser procedure. And here he is. He made a commitment. He invested in his own health, his own body. Folks, I'm going to tell you right now, you get a fusion or a discectomy done, you're going to be suffering with consequences the rest of your life. All right, guys, I need the irrigation working properly. All right. Jordan, my friend, can you go take a look at that irrigation? There we go. Okay, so understand what you just did to make it work and make sure you do that first next time. Okay? You want to share with us what you learned about the irrigation?
Yeah, certain bags, the spike needs to go deeper, I guess, depending on how the nature kind of back.
I love it. Good job. Self-discovery, very important. Any questions?
We have another one.
Oh, wonderful. 10 minutes, Dr. Berndes, 10 minutes.
Joni off of YouTube.
Joey?
Joni.
Joey?
Joni.
Oh, Joni, sorry. Okay, yes, of course.
If you had a previous back surgery posterior approach with discectomy, laminectomy, and fusion with
Yes.
donor bone,
Yes.
would I be a candidate for laser surgery to fix another disc? I have no disc.
Yes. Yes, you would, Joni, 100%. We get your question all the time. So the question is quite simple. I've had back surgery, I had a fusion, but now I have a problem at another disc. Can your laser be used to fix my back? The answer is 100% yes, yes, yes. We do it all the time. I want to point something out right now. Guys, look at this stringy stuff here. It looks almost like a web of a spider. That is scar tissue. This is all scar tissue from inflammation happening here at C4-5 at the back of the disc due to the herniation. The herniation causes this inflammation, and after years of inflammation, you get a buildup of this webby stuff. That's why if you have a herniated disc, get it fixed right away. Don't wait. Come to Duke Spine. Let us repair it. Get it done the right way. Now, I was asked about, I've had a fusion in my back. Can you do laser to fix the disc next to the fusion? The answer is 100% yes. So what do we call that? We call that adjacent segment disease. Adjacent segment disease means you had surgery on your spine, and now the forces that normally went through that moving disc that you fused are now being transmitted more to the discs above and below your fusion. So they wear out faster. By the way, that's a bone spur right there. I just zapped. Okay, you guys saw that? Zappy, zappy, goodbye. You know, I think one of the reasons why this patient likes the laser so much is kind of like welding. You get to melt away things, you know? All right. It's pretty cool. We get to melt away the herniation. So this adjacent segment disease, where you get a fusion or surgery done like an artificial disc, and then you develop problems at the disc above or below as a result of that surgery, we don't have that with Duke Laser Disc Repair. We've been doing this surgery 20 years now here at Duke Spine. We've done over 2,650 surgeries. We're almost at 2,700. And in 2,650 of these surgeries, 3 minutes, we've never had adjacent segment disease. Never. Not once. Not one of our patients has ever had adjacent segment disease. Not a single one. So adjacent segment disease happens when you, as a surgeon, you go into the spine and you stick something in the disc, either an artificial disc or a cage. And what happens is you're changing the patient's spinal biomechanics. You're changing the way the spine moves. Guess what? We're not doing that with the Duke Laser Disc Repair. We're not sticking anything in the disc. folks. All we're doing, look at all that inflammation, by the way, that red stuff. It's just crazy how much inflammation there is. All of that is due to the herniation. All right, we just cleaned it out, it's gone. Scar tissue here, lots of scar tissue. I cannot take all the scar tissue out, we don't need to. It'll just be replaced by more scar tissue. So what I'm going to do is get rid of the stuff that I think is a problem, leave the rest. We're just about done. I got about a minute or more, maybe 2 minutes left. You see all these pieces of herniation coming out of the tube, out of the disc and out of the tube. Any other questions?
No current questions at this time.
All right, well, we're just about done. So thanks for joining us. We'll be back shortly with another surgery. The next patient, there's another herniation coming out. The next patient, she's from Florida. She's the one before the patient from Iceland, I believe, right? And like I said, she had a fusion with me almost 20 years ago, and now she has adjacent segment disease, and we're going to fix her SI joints and her piriformis muscles. Who's moving? That's not the patient. That's just Luis. All right, we're done.